Hi class, in this recording we're going to focus on senescence of the male reproductive system, so the loss of function as males age. We find that as males age there's a general decline in testosterone secretion, so there's just a steady state decline. Unlike with females with menopause, where there's that dramatic decrease in sex hormones, for males it's a steady decrease as the male ages. There's also going to be a steady decrease in sperm concentrations and overall libido or sexual desire in the males. Males are capable of being fertile into old age. However, a key problem for them is that they become increasingly impotent. So they have a decreased ability to maintain an erection, to achieve and maintain an erection long enough to ejaculate into a female's vaginal canal. And this impotence is oftentimes related to atherosclerosis, so the buildup of plaques within the blood vessels, high blood pressure, medications, or psychological reasons. As we look at the concentrations in testosterone as males age, when males are young and they're at the age of 20 on average, they have a concentration of testosterone or a secretion of testosterone of 7 milligrams per day. And by the time they are 80, that has declined to about 1/5 of that, so about 1.4 milligrams per day of testosterone being secreted. For reference, a healthy female in her early 20s will typically have a concentration of testosterone, or daily secretion, I should say, of testosterone, equivalent to a healthy male in his 80s. This decrease in testosterone secretion for males as they age is typically a result of the Leydig cells, or the interstitial endocrine cells, becoming involuted and being downregulated and becoming non-functional. As males age, there's an event known as andropause, and this andropause is kind of similar to menopause for females, and this is just a period of time when there's declining reproductive function. It typically begins in the early 50s for males, and typically it's going to be marked by the upregulation, the increase in the percentage of males who are impotent or have erectile dysfunction. And as these males reach andropause, or have that steady decline in testosterone concentration and steady rise in erectile dysfunction, they are going to have a decreasing amount of sperm in their semen. However, they are still capable of fathering children when they're quite old. As of what I checked, the oldest male to father children is Ramjit Raghav, and I apologize for getting his name wrong there. He claims to have fathered a child at the age of 96, which I just cannot comprehend. I'm someone in my mid-30s right now, and I'm already exhausted with being a parent. I can't imagine being a parent of a young child in my 90s. My hat's off to this guy. As we look at males, that age-related drop in testosterone is going to cause an upregulation in follicle-stimulating hormone and luteinizing hormone. And that upregulation of FSH and LH can cause some males to have mood changes, some temperature, thermoregulation issues, or some males report having illusions of suffocation as they age. As males age, there's an increasing percentage of males that have ED, erectile dysfunction, also known as impotence. They can't produce the erection, or they can't keep the erection going long enough to ejaculate within the vaginal canal. So when we look at men in their 60s, about 1/5 of men in their 60s have erectile dysfunction. And by the time we get to men in their 80s, about 1/2 of men in their 80s are going to have erectile dysfunction. To treat erectile dysfunction, we are going to have a chemical that is a phosphodiesterase inhibitor. The first one hit the market, everyone knows about Viagra. It hit the market, I want to say, in the late 90s. And to give you some historical context, Pfizer, when they were doing clinical trials on Viagra, were trying to come up with a medication to treat high blood pressure or hypertension. So they were coming up with a chemical that would upregulate the effect of nitric oxide. So Viagra is a phosphodiesterase inhibitor. So as a phosphodiesterase inhibitor, it is going to downregulate the activity of phosphodiesterase number 5. And by downregulating the activity of phosphodiesterase number 5, it's going to upregulate the concentration of cyclic guanine monophosphate. cGMP, and that's upregulating the concentration of cGMP is going to cause that individual to have relaxation of the smooth muscles of his blood vessels, within the tunica media of his blood vessels. And that is going to, in particular for males with the internal pudendal artery, is going to cause more blood to flow into the penis, to the erectile tissue of the penis, and cause that penis to become erect. So during clinical trials for this high blood pressure medication, the doctors noticed that, it did help treat high blood pressure, but a whole bunch of males noticed this other side effect. They had all of these erections. Their erectile dysfunction went away. And Viagra, in a stroke of marketing, Pfizer, in a stroke of marketing genius, rebranded the medication to treat erectile dysfunction as opposed to high blood pressure. The reason high blood pressure medications are contraindicated for receiving ED medications is because they both are going to act on the same thing. They're going to cause vasodilation of the blood vessels. So if somebody's taking high blood pressure medication and then they take an erectile dysfunction drug, they are in danger of having their blood pressure bottom out. They have very low blood pressure. They're also in danger of having too much of an erection. And having too much, it is possible to have too much of a good thing. If the erection lasts for longer than 3 hours, the male is in danger of having their intrinsic clotting cascade activate within the erectile tissue of his penis, and then he can have blood clots form within his penis. This is a life-threatening problem, and to treat erections that will not go away, oftentimes emergency room technicians will first resort to the ice treatment. They will put the penis on ice to cause the erection to go away. And if that does not work, the emergency room technicians oftentimes will use a large gauge hypodermic needle to manually withdraw the blood from the erectile tissue. Although I imagine just looking at that needle may also be effective to cause the erection to go away. That's all we have for this presentation on senescence of the male reproductive system. If you have any questions or comments, please feel free to post them in the class discussion board. And as always, happy studies.